Your brain isn't just responsible for thinking and memory. It's the master control center that runs every single system in your body. Grab your labs. We've got a new twist. Hey there, and welcome to Unshakable Brain. I'm your guide, or this podcast is your guide to an unshakable brain. I'm Dr. Kylie, your host, and every week we bring you stories, science, and strategies to help your brain grow stronger, more resilient, and ready for anything. This episode is brought to you by Dr. Rewire's Brain DNA Test. Check it out at unshakablebrain.ai. If you are a practitioner and you want to incorporate this brain test into your toolkit, go to unshakablebrain.ai/expert. All right, on today's podcast, we're going to dive into some labs because on last week's podcast, LaCrista dropped some. It could be parasites, it could be infections, it could be leaky gut. How do you know and can you find these answers inside your regular labs? Yes, you can. First, let's talk about a paradigm shift. Stop asking yourself, what supplement will fix my anxiety? Start asking, what does my brain need to make calming brain chemicals effectively? Stop asking, what medication will help my energy? Start asking, what's preventing my brain from telling my cells to make energy efficiently? Stop asking, what diet will fix my gut issues? And start asking, how can I restore proper brain-gut communication? When you understand that your brain is the master control center, you realize that one, symptoms are messages. Two, multiple symptoms often share a single root cause, and there are many root causes. Three, true healing happens when you restore optimal brain function and communication pathways because your brain controls everything else. Four, your labs can reveal what is disrupting that brain-body communication. However, there is a missing piece when it comes to your blood work. Your blood work can reveal a whole sorts of information about organs and systems of the body, but it does not reveal specific markers or does not have specific markers for your brain or your nervous system. That is where the missing piece comes into play, the brain DNA test. If you haven't checked it out, please go to unshakablebrain.ai. That is the perfect combination with your regular blood work, in which we're going to start getting into today. LaCrista last week opened up the concept of infections and how bacteria and parasites and viruses can get between our fence cracks, our blood-brain barrier, and enter our brain. She was talking about some post-mortem studies. Interested in hearing more about that, and you haven't listened to last week's episode, go jump in. Right now, let's jump into how infections hijack your brain's command center. You need to understand what's happening inside your brain when these infections take hold. Your brain has its own immune system, completely separate from the rest of your body's defenses. What? I know. When infections cross into brain tissue or create chronic inflammation, it's like having intruders in your command center. Let me give you an example of a patient I once helped conquer some health struggles. We're going to call her Sarah. Sarah was 16 when her world turned upside down. An honor student, athlete, and social butterfly, she could not get out of her bed on most days. Her parents took her to doctor after doctor. Depression was suggested, maybe even prescribed something for. Chronic fatigue syndrome was mentioned. Some doctors even implied that she was faking it for attention. But she knew she wasn't faking anything. She was experiencing what happens when your brain's command center gets compromised. Her brain fog was so thick she couldn't follow conversations. This wasn't a lack of focus. This was inflammation disrupting communication between her brain cells, neurons. Imagine trying to make a phone call during a thunderstorm with a poor signal. The words are there, but they can't get through clearly. Or if you're on Zoom call and the internet is flaky and you're like freezing every once in a while. That's what it's like. The exhaustion was unlike she'd ever experienced. Sarah used to run 5 miles after school in cross country and still have energy for homework and friends. Now she was rationing energy just to shower. This occurs because your brain uses 20% of your body's total energy, and when it's fighting infections, there's less available for anything else. Her brain is literally choosing survival over living. Oh, let's get into her lab specifically because her body was fighting a virus, and that showed up in her monocyte number. When I checked out her labs, her monocytes were at 14%. If they are over 7%, there's a flag to that. That means viral. And when they get probably above 10%, you're looking at specifically mono, positive for Epstein-Barr virus or mono. So that's what was happening inside her labs. Now, when it comes to the rest of the labs inside the CBC, let's take a look because monocytes are just one marker of 5 that are very, very important when it comes to these infections and your blood-brain barrier. Inside your CBC with differential, the top marker you'll see is the white blood cell count. This is like looking at the overall activity level on your brain's defense system. When it's elevated, your brain is calling for backup to fight infections. When it's depressed, your brain's army might be overwhelmed or depleted. Or it could be the autoimmune component, which we will get to. All right, that's the white blood cell count. You want it to be between 5 and 8. If it's less than 5 or greater than 8, we've got infections on our hand, low-grade chronic infections, not something that's going to come up positive on a lab test. Unless your monocyte count is 14, it might come up positive on a mono test. These are things that go unnoticed, but they wreak havoc and therefore create symptoms which can lead to diagnoses. The first one you need to know are the neutrophils. These are your brain's bacterial infection specialists. When neutrophils climb over 60%, this may indicate bacterial activity that could contribute to inflammation. That inflammation disrupts our mood, our energy, and our cognitive function. Neutrophil count greater than 60%, think bacteria. Think fungal too. There's just not a direct correlation with neutrophils and fungi, but typically if there are bacteria, there are fungi as well. Our viral fighters are our lymphocytes. That magic number is 30%. If your lymphocyte marker is greater than 30%, your cells who specialize in fighting viral infections are very, very busy. This can lead to the most popular 3 components of lymphocyte markers elevated, lead to anxiety and depression, lead to chronic fatigue, lead to autoimmune conditions. Those are the top 3 biggest pieces. Why? Because they're viruses. Do I care what virus? No. When it comes to natural therapy, I don't typically care what type of virus it is because tackling infections typically involves similar things. Monocytes are also infection markers. The magic number for monocytes are 7%. These cells specialize in fighting the viruses. Viruses are then attacking your brain's energy production and chemical messaging systems. The most common complaints I hear, again, are anxiety and depression, fatigue, and autoimmune diseases. That's across the board for viruses. So you can have lymphocyte markers elevated above 30%. You could have monocyte markers elevated above 7%. And these not only attack your body, but they attack your brain. The parasitic fighters are eosinophils and basophils. However, these also are markers for, it's going to come to me, allergies. When either of these markers, eosinophils above 3% and basophils above 1%, are elevated, parasitic toxins are likely crossing into your brain tissue and creating the kind of neuroinflammation that triggers autoimmune attacks. The key insight here is that you're not looking just for infections in your body. You're identifying what's attacking your brain's command center and disrupting its communication to control everything else downstream. There is one pattern in these infection markers that's particularly important to understand. If you've been around me, you probably know what I'm talking about, the 1-to-1 ratio. Remember how neutrophils are, the magic number is 60%, and lymphocytes, the magic number is 30%. Well, 60-30, that is a 2-to-1 ratio. When the ratio becomes 1-to-1, we need to pay attention. When you see something like neutrophils at 46% and lymphocytes at 42%, well, there's our 1-to-1 ratio. And this pattern can suggest an overwhelmed immune system that could potentially begin attacking healthy tissue. It can indicate that your brain's immune system is so overwhelmed by fighting multiple types of infections simultaneously that it's become attacking your own tissue. There are, I think, over 80 autoimmune diseases at this point, and this doesn't necessarily mean you're going to be diagnosed with one. It just means that you might be having a reaction, an autoimmune reaction type in your body. So now you know. Remember, when your brain is healthy and free from chronic infection-related inflammation, everything else in your body works better. Like we talked about on the previous episode, some of these guys can cross over the blood-brain barrier because when you have leaky gut, you've got leaky brain at the same time. Okay, we've discussed some labs. And because we've discussed some labs, and we will discuss some labs, and we'll talk about patients and their results here, I gotta read to you the medical disclaimer, okay? And this goes for not just this podcast episode, but any future and past podcast episodes. So here you are. I'm a doctor, but I'm not your doctor. I don't know your personal health history, current medications, or individual circumstances. What I do know is that I specialize in reading normal blood work to uncover real answers about brain-body dysfunction, answers that lead to genuine healing and renewed hope. This podcast provides educational content about interpreting blood work results through the lens of brain function and offers information about genetic testing for ideal brain performance. However, interaction with this or any of my social media or book does not establish a doctor-patient relationship. You need to know that if your lab results fall outside normal ranges or if you have concerning symptoms, seek appropriate medical evaluation and treatment from a qualified physician. You also need to know that I do not recommend you discontinue prescribed medications without medical supervision. When we talk about vitamin D, medical monitoring may be appropriate. Genetic testing provides educational information but should not replace proper medical diagnosis and treatment. When we talk about case studies, these are individual experiences. These examples are shared for educational purposes to illustrate concepts. Individual results may vary significantly, and these cases should not be interpreted as typical outcomes, guarantees, or the like. Every person's health situation is unique, and what works for one individual may not be appropriate for another. The lab ranges that I discuss are optimal ranges, and interpretive methods presented here differ significantly from the standard normal referent ranges used in functional medicine. Think about when it comes to terms of these labs. Functional medicine training and advanced laboratory interpretation is typically where I have gathered this information up, as well as my clinical experience, research-based experience, as well as the methods from Dr. Datis Karazian. Please note that the lab interpretation methods in this podcast are educational tools and understanding and for your understanding of your health markers. For implementing changes based upon your results, especially if you're on medications or have complex health conditions, please work with qualified practitioners. I do not accept clients anymore. I don't work with practitioners. I don't work with patients. If you want to work with somebody who I recommend, please look into the LEMD telemedicine group. These clinicians can help you guide and implement safely. Regarding the brain genetics testing, while brain genetics testing provides valuable insights into your neurological blueprint, genetic science is rapidly evolving. The recommendations based on genetic testing should complement, not replace, comprehensive medical evaluation and should be implemented under professional guidance. You have a responsibility. You are responsible for your own health decisions. Using this information as educational material to make informed discussions, please discuss with your healthcare providers and your healthcare team. Always work with qualified practitioners when addressing health concerns, especially when dealing with chronic conditions or complex systems. This podcast provides education, not medical advice. If you are interested in learning more about the LEMD practitioners, and if you are a practitioner who wants to implement this or add this to your toolkit, I highly recommend it, especially as you learn more about peptides and the power of peptides. Get started at https //LEMD, that's ELLIEMD.com/B as in boy, P as in play, =, Dr. Kylie. I know, but I have to read that to you guys. And just let you know that what we discuss on here has legal implications. Like I said, I don't accept clients anymore, not patients, not practitioners. So if you are looking for someone to help you with your health, especially on a one-to-one basis via telemedicine, go to LEMD. That's ELLIEMD. Use my link in the show notes, and you are ready to rock and roll. As a practitioner, you can implement this into your patients as well, give them access to this information. It's a great way to monetize social media followings and all the things. So I will post those links in the comments if you're interested in getting into that. All right, there's a new episode on Unshakable Brain. Until next time.